Hello everyone. Greetings from Fortis Hospital, Cunningham Road. This is Dr. Ramraj Nagendra Gupta. I'm a consultant surgical gastroenterologist, advanced laparoscopy, bariatric and metabolic surgeon. Today we'll be speaking about obesity. It is important to understand what obesity is, what are the causes for obesity, how obesity is measured, what are the health effects of obesity, and what are the treatment options that we have to treat this menace. Obesity is a chronic disease which affects a wider section of the society. It not only affects adults but also children. It affects both men and women. Obesity has reached epidemic proportions, and in India it is considered as 1 in 5th individual is either an overweight person or an obese person. With disease reaching this pandemic proportions, it is very important to understand what are the causes, to identify these causes, to measure this obesity, and also to understand the treatment options. Obesity can be because of a single factor or it can be multifactorial. When there is a single factor, it can either be due to hormonal disturbances or it can be because of psychiatric disorders or eating disorders. But the most important reason for obesity is an imbalance between energy consumption and energy expenditure. Obesity can cause different diseases in the body. It doesn't spare any organ system. It affects the central nervous system. It affects the eyes. It affects the heart. It affects the kidneys. It can cause degenerative disorders in the knee joint. It can affect the spine. It can cause urinary disturbances. It can cause depression, and you name it, and there are different diseases which can be attributed to obesity. And not to forget cancers, where obesity is one of the leading cause for cancers. When it comes to measuring obesity, obesity is measured in different methods. The most important method is using the body mass index. Here we use the height and weight of an individual and calculate the body mass index using a formula. The World Health Organization has divided this body mass index into different categories. Any individual with a body mass index of more than 30 is considered to be obese, and anyone with a body mass index of more than 50 are considered to be super obese. We do have other techniques to measure obesity. One of them is the waist circumference. A male person with a waist circumference of more than 90 centimeters is considered obese, and a female with a waist circumference of more than 80 is considered to be obese. We also use what is called as a waist and hip ratio. A ratio of more than 0.9 in men and a ratio of 0.8 in women are again considered to be obese. There are again techniques where we use imaging modalities to identify the percentage of fat which is deposited in the body to categorize obesity. So what are the treatment options that we have to treat this obesity? Obesity, as you are aware, is a lifestyle related disease. Diet and exercise is the mainstay of treatment when it comes to management of obesity. The other options are we have medical therapy. We also have endoscopic approaches or balloon, where balloons are inserted into the stomach to reduce the capacity and help in reducing weight. Then we have the surgical options, which is also called as bariatric surgery. These bariatric surgeries are something which is pretty safe, and this is used as a last option in patients who have failed to reduce weight after the initial approaches have been attempted. Thank you.